Hi, I am Dr. Narendra, consultant endocrinologist at Aster Whitefield Hospital. Today I'll be talking about type 1 diabetes. The prevalence of type 1 diabetes amounts to about 5 to 10% of all the diabetes diagnosed, commonly seen in children and young adults less than 25 to 30 years of age, but can be diagnosed at any age during the lifetime of a particular person. The commonest reason for someone to get into type 1 diabetes are genetic reasons, viral infections, or puberty, where there is an autoimmune trigger of the antibodies which are directed against the pancreatic beta cells, and they lead to complete loss or destruction of the pancreatic beta cells, where their patients become completely insulinopenic or insulin deficient. So because of this, the patients who present with type 1 diabetes come with very high blood sugars at the initial stage itself, or they may also present to the emergency room in the form of diabetic ketoacidosis, which is usually an emergency in treating these patients. If not treated well, it could increase the morbidity and mortality of these patients. Now, because these patients are completely insulinopenic, the treatment for this kind of patients are only insulin, and there is no other options available, and it is ideally given 4 times a day, called also known as basal bolus regime, which is usually mimicking the normal physiological secretion of insulin. The other better option would be use of insulin pump, which is also a very good way of treating these patients, and it also improves their quality of life and also helps them in having a healthy and improved lifestyle. So these patients need to have a regular insulin, and also these patients need to have a regular consultation with their doctor, and it's very important because to have a good glycemic control, you would prevent the complications of diabetes, mainly the micro and the macrovascular complications of diabetes. So a very regular intake or use of medications like insulin is a must, and also regular follow with the HbA1c is very important because it tells us how the diabetes is under control, and also it helps to prevent or delay the onset of complications. And now with the use of continuous glucose monitoring or the use of CGM, the glycemic management for these patients have become very helpful, and also we can prevent the risk or incidence of hypoglycemia and also improve the quality of life. And we at Aster Whitefield Hospital not only provide care for type 1 diabetes, but also type 2 diabetes and other forms of diabetes, thyroid disorders, and also being a multidisciplinary hospital, it also covers a very comprehensive care for your type 1 diabetes, including the eye care, kidney care, and the cardiac care and other associated conditions.